Hi, my name is Shelby Weddington, and this is my discussion board post number 4. My retrospective cohort study was done on non-small cell lung cancer in ever smokers versus never smokers. The purpose of this study was to compare the clinical, the imaging, pathology, and outcomes of patients who had never smoked and patients who had smoked. For the imaging, never smokers and smokers had similar nodule size, calcification, and metastases, with p-values that all suggested that these were not dependent on having smoked or not. In the initial staging, never smokers were more often diagnosed with stage 4 disease, positive nodal disease, and metastatic diseases with p-values, all suggesting significance. For the pathology, never smokers tended to have adenocarcinoma, whereas smokers tended to have both adenocarcinoma and squamous cell carcinoma, and the p-value of this suggested that they were significant on whether or not they had smoked in the past or not. For the outcomes, smokers had nearly double the risk of all mortality in 5 years and 10 years. The median survival rate of never smokers was 6.6 years, whereas the median survival rate of smokers was 3.9 years, with p-values suggesting significance. For my case control study, I did this on vaping, smoking, and lung cancer risk. The purpose of this was to examine the association of vaping and cigarette smoke by comparing a group of individuals with diagnosed lung cancer to a group of individuals without diagnosed lung cancer. The odds ratio was adjusted for gender, age, and race, as well as prevalent comorbidities such as COPD and CAD. All control subjects compared to the exposed were from the same area. Age and gender and race were all the same distribution as well. The odds ratio for when only adjusted for age, gender, and race was 58.9, but when further adjusted for comorbidities such as COPD and CAD, the odds ratio went down to 9.6. In conclusion, the patients were 58.9 times more likely to have lung cancer if they vaped and smoked in combination versus patients who only smoked were 9.6 times more likely to have lung cancer. So for the comparison, both studies gathered their data via electronic medical record. Both studies were completed retrospectively, but the difference between these two cases was that in the cohort study, both sets of groups studied already had the disease in question, and the prevalence of smoking versus non-smoking was compared between the two groups. Whereas in the case control study, researchers studied two groups of people who smoked cigarettes in combination with vaping, comparing the groups having been diagnosed with lung cancer and the other control group not having been diagnosed with cancer. That is it. Thank you.